The first duty of medicine is to do no harm. But is the Texas Medical Board letting doctors with dangerous pasts still practice? That's what some patient advocates who spoke with KXAN fear. We previously revealed the state agency was keeping some doctor disciplinary records secret, contrary to state law.
Now, investigator Matt Grant discovers multiple doctors still allowed to treat patients even after the board determined them to be a threat to public safety.
What brought you here today? Lower back pain.
You're watching an undercover officer with the Drug Enforcement Administration posing as a patient to investigate reports of a cash-only pill mill in Houston.
Okay, have a seat on the table. Let's examine this. Okay.
After meeting for the first time for an exam lasting just 30 seconds.
That is not chronic pain. That is acute pain.
The DEA says Dr. James Pierre wrote up a prescription for 60 hydrocodone pills.
No more than twice a day for the payment. Okay.
We obtained this 2016 video from the DEA. The feds arrested Pierre the following year. He was convicted this past March for illegally prescribing more than 1 million opioid pills. Federal investigators say Pierre prescribed potentially deadly cocktails of pain pills and muscle relaxers without any legitimate medical purpose. Court records show the operation netted the clinic more than $2 million over 1 year.
Yeah, this is not a clinic for playing around.
Turns out the Texas Medical Board was aware of this and still allowed Pierre to practice. In 2016, the board's own records show he was suspended for operating an unlicensed pain management clinic where nearly 10,000 prescriptions for controlled substances were written. But 10 months later, the board lifted his suspension. In its records, the board cites factors like he expressed remorse, had a genuine misunderstanding of pain management requirements, and was a very young and inexperienced physician, even though he was 46 at the time and had been practicing for over a decade. The TMB said Pierre could continue seeing patients with certain restrictions, like not being able to write long-term prescriptions for controlled substances or treat chronic pain patients for 5 years. More than a month after his federal conviction, Pierre's license was still listed as active on the TMB website with no record of that criminal history. He could face up to 20 years in prison when sentenced next month, or messages left with his attorney were not returned.
We shouldn't be relying on our police and our prosecutors to finally stop these doctors from hurting people.
Ware Wendell is the executive director of Texas Watch, a nonpartisan group based in Austin that advocates for patient safety.
We need the medical board to step up and do their job. And they say that their job is safeguarding the public. Do it.
According to its mission statement online, the TMB's role is to protect and enhance the public's health, safety, and welfare by maintaining standards of excellence and ensuring quality health care through discipline. But our investigation found in at least 8 cases where doctors face multiple complaints and even convictions, the board has allowed them to keep practicing. Most of those cases involve doctors recently and credibly accused of sexual misconduct with patients, like when the board labeled Austin family physician Dr. David Butler a threat to public welfare and suspended his license in 2019. The board's own investigation found a pattern of inappropriate sexual contact with at least 10 patients, including a minor, some who he also inappropriately prescribed controlled substances without medical justification. But 2 months after suspending his license, the TMB lifted his suspension, only allowing him to treat men over 18. Within days of that action, the board warned Austin police about Butler's possible criminal violations. APD later arrested him for possession of child pornography. Court records describe scores of images on a thumb drive, some allegedly as young as toddlers. Butler declined to comment about the ongoing case.
I tell you that the board is very lax when it comes to recommending physicians.
These examples are not a surprise to this TMB insider whose identity we're concealing. The current employee says complaints from hospitals and doctors get priority over those made by patients, describing a lack of investigative resources and a reluctance to take away a doctor's ability to earn a living.
Yes, we are here to protect the public, but in reality, I don't think they do enough.
The TMB declined an on-camera interview. In a statement, the agency said, "The board seeks to take action based on the evidence at the time that it feels can best protect the public in any given case, while also providing the physician with statutorily required due process through the investigation and administrative proceedings." We looked at disciplinary data from 2019 through 2021 and found in the last 3 years, 83 Texas medical licenses were taken away or surrendered. That's less than 2% of all investigations.
Matt, how does Texas compare to other states?
Well, Florida, for example, 50 to 66% of all investigations in the last 3 years led to some kind of discipline. In Texas, it was 10%.
Matt, thank you so much. And because of what KXAN uncovered, State Representative Julie Johnson is drafting a bill and calling for the Texas Medical Board to be audited. Tomorrow on KXAN News at 10, we're looking into who sits on the medical board to find out how money and politics intersect with patient safety.